Development, Executive Director of International Society of Media in Public Health, Chief Mojima Kanjola, highlighted this during the dissemination meeting of its EU Act-supported project on empowerment of women and the prevention of severe acute malnutrition in the FCT. Lois Abasambo has details.
Executive Director of International Society of Media in Public Health, Ismph, Chief Mojima Kanjola, said poverty has been a major factor fueling malnutrition, most especially in rural areas, despite the numerous resources at their disposal.
At the communities where we worked, it was shocking to find children that are severely malnourished. And I always say that, my country is not at war. Why should we have children that are severely malnourished? And we found out that some of the mothers don't have the knowledge in terms of the food mix, particularly when the children are weaned off breast. Some of them are not adhering to exclusive breastfeeding. And as media in public health, we thought the least we can do is to promote healthy lifestyles that includes the children.
Also speaking, the ASU of Kwali, Alhaji Shaban Audu Nizazo III, and other stakeholders said with diet education and sensitization, malnutrition can be tackled in the rural areas.
We have to educate our rural women or the rural poor or the urban poor to know that malnutrition is not going to be resolved by any witchcraft. And therefore, it is education about the human being. What is the system? What are the systems in the human being? What affects human being? And therefore, when we know that malnutrition is caused by lack of food, lack of balanced food, then the people will now begin to understand that they have to eat well.
Some of the beneficiaries of the empowerment program highlighted how they have been impacted so far.
Program have really helped me for my first son. This is not my first baby. It's a kind of child that doesn't eat, always take all these liquid things. But when I get to know about this program, I come to notice that with soya beans, groundnuts, that I can mix them in pap. But with this, I've come to notice that with my pap, I can put groundnuts with depth and this debino and mix them together and grind and give him.
So when they came to train us, we started making charcoal and fertilizer. So when they finished training us, they give us money. So we now went to buy the goods and start making our own.
Each year in Nigeria, more than 2.5 million children under age 5 are affected by severe acute malnutrition. However, with basic health care and treatment, children with malnutrition can recover quickly. Lois Abasambo, ASO Television News.